Vital Keys for Health Optimization. In this lecture, we will talk about screening tests, routine examinations, and simple precautions that can help us stay ahead of the curve in healthcare. In 2009, the Harvard School of Public Health released a study showing that smoking and high blood pressure are the two leading causes of death in the Western world. In fact, we, as individuals and society, can do something about these two major risk factors when we make our lifestyle choices. Nowadays, we have a huge number of good diagnostic and screening tests that can help us either treat or prevent many serious illnesses. For example, in recent years, 2 gene mutations have been discovered that are linked to increased risk of developing both breast and ovarian cancers. They are called BRCA1 and BRCA2. People who have these genes may benefit tremendously from prophylactic mastectomy. Likewise, screening mammography also has been shown to have a protective effect on women in the age group 50 to 69 years old by detecting breast cancer cases at earlier stages, which makes these cancers more treatable. A routine serum cholesterol screening is helpful because it is easy, inexpensive, accurate, and predictive for future serious disease such as asymptomatic coronary artery disease, which are the main cause of heart attacks. Other tests that may provide an early diagnosis for diseases that can be treated include a pap smear and a screening colonoscopy. With regard to hypertension, the diagnosis has become much stricter. We now believe a blood pressure of 120/80 or above is borderline hypertension. The higher number, systolic pressure, is the peak pressure that your blood vessels sustain when your heart is pumping, which gives you a higher risk for stroke because the pressure is also up in your brain. The diastolic, the lower number, is the pressure as your vessels relax. DEXA scans, which measure the minerals density in the bones, can detect early osteoporosis, which is a signal for risk of spontaneous bone fractures, mainly in women over the age of 50. Finally, the cardiac treadmill stress test is an exercise test designed to pick up an asymptomatic disease in the coronary arteries. The availability of all these tests leads us back to the need for regular visits to family doctors who can take detailed histories and conduct physical examinations to make appropriate decisions about which screening or diagnostic tests will be beneficial in order to detect ailments in our bodies at an earlier stage, which in most cases makes treatment easier and more successful. Furthermore, it is always prudent to remember that prevention is always preferable to trying to cure an existing disease. If you smoke now, you need to stop. Worldwide tobacco-related deaths exceeded 8 million per year in 2018 and are expected to reach about 10 million per year by 2030. In addition to the expected 300,000 new cases worldwide of lung cancer in 2021, smoking also causes cancers of the neck, tongue, larynx, esophagus, and bladder, along with heart attacks and strokes. There is no question that avoiding any exposure to tobacco smoke, which can be either actively when you smoke tobacco or passively when you inhale the smoking fumes of others, is the single most effective measure in terms of reducing the risk of sickness, which is known as morbidity, and the rest of death, which is known as mortality, that can result from smoking tobacco. Moreover, tobacco products increase sympathetic nervous system activity, which is the part of the nervous system that releases adrenaline, which increases the oxygen consumption of the heart muscle, along with the heart rate and force of contraction. Over time, this causes stiffening of the arteries in the body, which in turn increases blood pressure. This indirect effect can last for decades. Stopping smoking can lower the risk of coronary artery heart disease by 33% in a relatively short period of time, even if you have smoked for a long time. High blood pressure is known as the silent killer. As mentioned earlier, acceptable blood pressure is now about 120/80. If you have hypertension, reducing your salt intake can make a significant difference. It may be the only thing necessary to get your pressure back to a more acceptable level. Exercise, weight loss, changes in nutritional choices, and reduction of alcohol intake are also well known to reduce blood pressure. Immunizations are also important in preventing disease and maintaining optimum health. Vaccines in adults could prevent about 80% of all influenza deaths, about 60% of deaths from pneumococcal infections, and 90% of hepatitis deaths. Readily available vaccines for the general adult population include those for pneumonia, influenza, and shingles. Interestingly, good dental care can be a factor in preventing heart disease that could happen as a result of the germs that migrate from a chronic infection pouch within the mouth cavity to the pericardium, which is the sac that covers the heart. Of course, brushing, flossing, and getting regular dental checkups are preventive measures you can take in this regard. Finally, hearing loss, which can be psychologically damaging, can be prevented by avoiding chronic exposure to high levels of noise. Treatment for hearing loss includes hearing aids and surgery. Parents are especially urged to protect their children from trauma to the nerves within the ears by ensuring that MP3 players are turned down to appropriate levels. Copyright Academy House www.academy.house